Welcome to your next video lecture in our continuation of Unit 5, our unit on therapy and positive psychology. Today's focus is on Module 5.5D, which is looking at biomedical therapies or treatments. This is in contrast to psychotherapy, which is what we've talked about up until this point. In order to utilize the biomedical therapies, you do have to have your medical degree and be considered a psychiatrist. And so that's going to be one of the biggest differences you're going to see between psychotherapy that we've been talking about and those biomedical treatments.
So kind of the goal of biomedical therapy is to change the biology to help the psychological. So this is based on the biomedical or the biophysiological approach. Again, those are synonym terms together. And they work to change what's happening inside the body to change how we feel or how we think. And so there's three different goals or techniques that are used. One is the most popular, which is drug therapies. Another was ECT and RTMS. And then finally, psychosurgery. So those are going to be our focuses for today's video lecture. So to begin with, looking at psychopharmacology, this has probably been the biggest shift, change, positive thing, I would say, that has hit treatment for individuals with mental illness. Right around 1955, you can see the introduction of antipsychotic medications. And then as that kind of like started this snowball of medications that are prescribed for individuals with anxiety, depression, bipolar, schizophrenia, as in those antipsychotic drugs. And you can see a rapid decline that we see in individuals who are hospitalized for mental health issues. So really, the introduction to psychopharmacology or the introduction to drug therapy to treat clients with mental illness has really had a strong positive correlation to helping individuals get out of facilities and to allow them to kind of get back to their daily functioning and to go back to as close to how they could be void of that mental illness. So it's a really important start graph to see. So when we look at drug therapy, there's kind of different categories of medications. So we're going to talk about anti-anxiety, antidepressant, and antipsychotic. Those are the three big hitter categories. So when we look at anti-anxiety medication, these are medications that are there to serve or to treat individuals with anxiety disorders. So this could be generalized anxiety, this could be phobias, this could be even obsessive compulsive disorder like OCD. And there's two medications that you should know. Those are Xanax and Ativan. And when we look at anti-anxiety drugs such as Xanax and Ativan, the goal is to depress the central nervous system. So much like alcohol does, it depresses that central nervous system, and that in turn reduces anxiety and tension that you experience. So it's going to elevate the levels of what's called the GABA neurotransmitter. So when it gives you more of that neurotransmitter, it helps to reduce anxiety and tension by depressing that central nervous system. And that's how the anxiety is lessened for that individual who's taking it. Another category is called antidepressant medications, and a kind of subcategory of antidepressants are called SSRIs, or selective serotonin reuptake inhibitors. So when we think about those words, selective serotonin, okay, we think about serotonin. What is serotonin? That's a neurotransmitter that we know is linked to mood. And individuals who have a decrease in serotonin are individuals who we know experience depression-like symptoms. And then when we think about reuptake, okay, if we think back to our neuroscience unit, reuptake is when a neurotransmitter has an action potential and it sends the messengers and the neurotransmitters across that synaptic cleft. Some of those neurotransmitters are reabsorbed into that sending neuron. So if it's a reuptake inhibitor, it's going to inhibit, block, stop, not allow reabsorption to happen. So when you don't allow reabsorption to happen of that neurotransmitter, essentially what you're doing is you are giving more of that neurotransmitter to the body. You are allowing more of that neurotransmitter to be absorbed by other neurons' dendrites. So you're essentially increasing the amount of that neurotransmitter that you have, which in this case is serotonin. So you can see in this picture, Prozac acts as those green little boxes, and you see that sending neuron right here. You see the axon terminal or the terminal button of that sending neuron that's sending out those neurotransmitters, which are those little serotonin balls that we want to be absorbed by the receiving neurons' dendrites. Prozac goes in and it blocks the reuptake. It blocks the reabsorption of serotonin to force it out and into that synaptic cleft, and hopefully to get it to be absorbed by neighboring dendrites. So, two medications that are antidepressants that act as these selective serotonin reuptake inhibitors are Prozac and Zoloft. Finally, we also have a discovery of treatment for individuals with bipolar. So we know bipolar individuals not only have the depressive episodes, but they also have the manic episodes. And so studies have found that lithium, which is salt, lithium drugs are helpful in the treatment of those with bipolar because it helps to decrease the manic episodes that they experience. They're not quite sure why it does. They just have found that it does work, and it is one of the most widely used medications for individuals with bipolar in order to control the dangerous effects that a manic episode can have. Next one we have is called antipsychotic medications. So this is to treat individuals who have schizophrenia. And we know when we think about the neurotransmitter that is most closely associated with schizophrenia, we think about dopamine. And an excess of dopamine is linked to schizophrenia. When you have too much dope or dopamine, you start to see things like hallucinations in schizophrenia. And so antipsychotic medications work to decrease the amount of dopamine that we have in our system. And so you can see here that in contrast to the SSRIs, which block the reuptake, instead the antipsychotic medications block the receptor sites, forcing the reabsorption of dopamine back into the sending neuron. So if they block the receptor sites, now these receptor sites think that they're getting clozapine, but they're really not, or think that they're getting dopamine when they're really not, in order to decrease the amount of actual dopamine that's going on in their body, to in turn decrease the symptoms of schizophrenia. So you can see there's two main drugs that we use as antipsychotic medications. One of the struggles with antipsychotic medications is being on them for long term can cause side effects such as tardive dyskinesia. And you see in these pictures, these are examples of what tardive dyskinesia can look like in an individual. So this can cause an individual to have muscle paralysis, can make and not be able to move from certain facial expressions. And so that's kind of a drawback or a side effect that is not ideal. But when you compare that to the symptoms of schizophrenia, sometimes you have to outweigh the negatives with the positives. So again, the goal of antipsychotic medications is to decrease the amount of dopamine that you have in your system. However, there could be a side effect of that, such as that tardive dyskinesia. Moving on to the next category, which is electroconvulsive shock therapy, also called ECT. This is people often refer to this as a very barbaric procedure, and they call it barbaric mainly because of how it's done, as well as the fact that we still today don't really know why it works. We know it works for patients who have really severe depression and suicidal ideations, but we're not quite sure how this particular technique works to do it. So what happens is a patient is put unconscious, they are given a muscle relaxant, and they have electrical signals sent to their brain that cause them to have seizures. And they would repeat that procedure, and then they would repeat that procedure over time. And they have found that individuals who have this procedure, they're able to reduce the depressive symptoms that they experience. kind of the best reasoning they've come up with is it's like a reboot for the brain. You know, think about if your computer is not working, and sometimes there's just nothing you could do but to just turn it off and turn it back on, and some reason it fixes something and it works. We don't know why, but turning off and turning on your computer or your phone just happens to fix it. And so we can look at ECT in the similar way, that it's almost like a reboot for your brain. We're almost like restarting those electrical connections, those neural connections in your brain, and that helps us. Kind of a less dangerous, we'll say, technique. Oh, going back to that technique, one of the things with electroconvulsive shock therapy, one of the side effects is memory loss that occurs. And the memory loss is for the procedure as well as kind of the hours before and after that procedure. So that's one of the side effects to that. So when we look at repetitive transcranial magnetic stimulation, this is an option that is a little bit easier to swallow because it does not have the side effects like you see in electroconvulsive shock therapy. The individual doesn't have to be put to sleep. There does not have to be a seizure that occurs, as well as there's no memory loss to this. But what they do here is they perform this on wide awake patients, and they do this over several weeks. And the goal is to send repetitive pulses surges through a magnetic coil on the person's head. And again, just like ECT, we're not quite sure why it works. One possible thing that they think is that it stimulates or it energizes the brain's left frontal lobe, which they believe is inactive during depression. And so they kind of have seen that perhaps this repetitive stimulation causes the nerve cells to kind of start making new circuits and forces those circuits to happen, causing that long-term potentiation or causing those neural connections to get stronger and grow where at one time we didn't have them, or we have a diminished amount because of the depression that we're experiencing. So it's a little bit less scary, we'll say, of a technique, but both techniques are used on clients or on patients today. The final one is psychosurgery, which is, we don't see much at all anymore. One of the most popular psychosurgeries is called a lobotomy. And a lobotomy is where we sever the connection between the frontal lobe and the emotion-centered portion of the rest of our brain. So as we know, the emotion-centered, the amygdala is a part of that emotion-centered portion of the brain. So we would try and separate or sever those two things. And this was done for very violent patients and patients with extreme hallucinations and delusions. And doing this procedure did work for that, but it also, once you do that, you kind of get that person to become lethargic, where they are no longer creative, where they almost are permanently missing their emotions and they become immature. And so they really kind of lose the essence of who they are. So yes, we get rid of the struggles that they're having, but at the same time, then what are they left with? And so that's where that introduction of medicine and antipsychotic medications is a much better choice for patients like this, because it gives them a chance to not, one, permanently change the structure of the brain, and two, to not have the severe side effects that we see in something like a lobotomy. So that is it for your video lecture on the biomedical technique. I will see you in class.